Okay, now let's look at the bones that make up the lower leg. So again, just like in the forearm, where we had two bones, in the lower leg we have two bones as well. We have the thicker of the two bones, which is referred to as the tibia, and the thinner of the two bones, which is known as the fibula. And a trick to keep that straight is I like to think of a fib as a small lie. So that's how you remember the fibula is the smaller of the two bones, because they do kind of sound similar. Also, you should remember that the tibia is the bone that's located more medial and the fibula is more lateral. And if you go back up to what we were talking about before, how this femoral head will always point toward midline, we know that's medial. So then we know that the tibia is also medial. All right, now let's talk about two bumps, a couple of bumps that we find first on the tibia. Again, our tibia is medial, so we have this little projection at the end of our tibia, a little flaring, and you can actually feel it on the medial side of your own ankle. This is called the medial malleolus or medial malleolus. This little flaring out, my arrow is not quite pointing where it should, but this flare. And then if we look to the top of this tibia, we have this big kind of chunky part. Oops, sorry, my hands got in the way. This big chunky part of the tibia, that is called the medial condyle. And it articulates with the medial condyle that we just talked about when we were talking about the femur. We also have a lateral condyle, that big chunky part of the tibia right here that my fingers are on. And then these are not tagged, these are just kind of extras. You don't have to, know them for me, but just kind of honorable mentions. We refer to this top surface of the tibia as the tibial plateau. And this is where we have two rims of fibrocartilage that we call menisci that kind of give the knee a little extra shock absorption. Also in light blue, right where my thumb is, there's another little bump. And again, if you find your own patella and you kind of come a little bit inferior to your patella, you'll be able to feel this bump on your own tibia. This is called the tibial tuberosity. And for those of you going on into physical therapy, that these landmarks are some things that you'll hear again. So there you have the tibia. And then the fibula, again, the smaller of the two bones, doesn't have a whole lot of landmarks. We have this flaring that's at the distal end. This is called the lateral malleolus or malleolus, lateral malleolus. And then we call this proximal portion of the fibula the fibular head. So there you have the bones in the lower leg.